everybody, thanks for joining me today, Dr. Ross Marcagiani, with another great word of the week at Turnpaugh Health and Wellness Center. Today we're going to be talking about Lyme disease and co-infections. We'll be talking about what you should do if you get bit and how we prevent from getting bit from a tick bite or if we get infected, what we should do. Let's dive in. So what is Lyme disease and co-infections? So Lyme disease, also known from its genus species as Borrelia burgdorferi, which is a spirochete, meaning it's a type of bacteria that has this spiralytic or basically like a corkscrew shape that can burrow into soft tissue, burrow into the central nervous system, burrow into joints. So you can see here, it affects joints, the immune system, the cardiovascular system, and the central nervous system. And again, this is more commonly known to be transmitted via tick, but it can really be transmitted any species that, any vector that collects a blood meal and can transfer that blood meal to other people. And just be aware here, there's more than just ticks or fleas or mosquitoes. Also, we can get transmitted from cats, from dogs. We can get transmitted, even research has been suggesting, possibly through sexual transmission. If you're pregnant, research has suggested that it could be possible that through the cord blood that your fetus or your baby could get infected if you get infected. So there are more ways to get infected than just a tick bite. So I just want to make people aware of that. Some other common co-infections here. Babesia or babesiosis. This is a parasite that has the same symptoms as Lyme, hence it's a co-infection that you can that should be tested for and be considered. Bartonella is a probacterium, again that you could it's a common co-infection. Another common co-infection that's on here is anaplasmosis, and as you can see here, unfortunately, there are way more than just those 3 or 4. You can see we have the Bartonellosis, we have anaplasmosis, we've got the Babesia or the babesiosis, we have the Poisson virus, we have various forms of Borrelia, so Borrelia burgdorferi, and there's multiple forms of Borrelia, as you can see, Miyamotoi, Borrelia garini, and so forth here. I just want to bring a quick little bit of attention here. You don't have to have a skin eruption every time, but you can see here that middle picture looks very common to what people are aware of, as such as a bullseye rash. That's pretty common for Borrelia burgdorferi, the Lyme tick bite, but there's other types of skin eruptions that you can get that are associated with Lyme and co-infection. But please be aware, you do not need a skin eruption just to confirm that you have a Lyme or co-infection. Just be aware of that. Now, prevention here. Now, I don't expect everyone to go out in a full fishnet suit when they're out wanting to go for a hike or walk. Let's get real here. We want to be, have some air so we're not sweating. We want to be able to move. But please be aware, if you're out in a heavily dense, forest area or high grass, wear protective clothing. Wear long pants. If depending on the temperature, wear long sleeves. Wear a hat. Just try to cover up, wear long socks, try to cover up as much skin as you can. If you can invest in clothing with permethrin or Avon SS already in it. You can use essential oils, garlic, eucalyptus, thyme, really helpful in bug prevention. You can look at making sure you're not wearing perfume. Just taking good precautionary steps if you're going out enjoying the environment, enjoying the beautiful weather, enjoying the summertime weather, excuse me. If you live around, you live in a heavily forested area, make sure you spray the perimeter with permethrin or some type of tick repellent. If you love animals, you can have guinea hens hanging out back there. They make a little bit of noise, but they love eating ticks. Again, avoid perfumes, and then just be smart when you're coming back in from the day of enjoying the beautiful weather. Check yourself, head in the shower, strip down, check every inch of your body to make sure that there's nothing that's being missed here, okay? Now, if you find a tick, what to do? Make sure you remove that tick as safe as possible. Then package it, put it in a bag or bottle. Try to, if you can, keep it alive. And then send that to the lab immediately. You can send that either to www.ticklab.org, where they'll do free testing for the Borrelia burgdorferi, the Lyme disease, or contact someone at Turnpaugh Health and Wellness Center. We'll make sure we send that out, and we'll test for Lyme disease and co-infections, okay? If yourself got bit, make sure you go and contact a Lyme litter doctor and make sure you get tested. Either a medical diagnostic laboratory, IGeneX, or Vibrant. Don't go to your standard lab and get standard lab testing. We want a little bit more detail. We want to look at those co-infections. In the meantime, while you're waiting, use some herbs. Johns Hopkins did a really good study on the effectiveness of herbs in killing Lyme disease. So they found the most effective in dormant and non-dormant states of Lyme disease was Japanese knotweed and cryptolepis. You can use some other herbs such as cat's claw, Chinese skullcap. You can use black walnut. You can use sweet wormwood. These are all helpful in killing spirochetes. So please just be aware, it's summertime. We want to go out and enjoy the beautiful weather. If you're in a heavily dense or wooded area, just be aware of the possibilities, and also that we can get this not just from a tick, okay? Thank you for your time here. If you have any questions or you're concerned about any possible infection, please contact myself or someone at Turnpaugh Health and Wellness Center, and we'll get you helped out. Thanks for your time. Have a great day.